Thanks, David. Doctors in Tennessee write more opioid prescriptions than there are people living in the state. That's according to Tennessee Together with the governor's office.
This trend has taken lives. Tennessee is one of the highest in drug overdose deaths.
Lawmakers are cracking down on the epidemic with new restrictions. Kylie Thomas joins us now to tell us how this could affect a lot more than people who are addicted to pills. Kylie.
Well, Josh and Latricia, we've all seen this little orange pill bottle. You can find it in pretty much any home, and lawmakers want to make sure opioid prescriptions aren't given to abusers. So they've introduced a new law that limits pills to a 3-day supply. Pharmacies in Tennessee are ringing in the new year with a new workflow.
It's definitely more of a headache to everybody who's doing stuff responsibly.
Jordan Morrison is a pharmacist at Access Family Pharmacy in Hickson. As of January 1st, he can only fill a narcotic prescription for a 3-day supply.
All the responsible prescribers, all the responsible patients, they all get grouped together because of a handful of some who are abusing it, and so that's frustrating.
Lawmakers passed this new law to cut down on opioid abuse, an epidemic David McNabb sees firsthand.
Whatever you've heard about the opioid epidemic, it's been soft-sold. It's worse than what you hear.
McNabb runs a recovery center in Chattanooga. He says about 80% of the residents' abuse history starts with opioids. Many turn to harder drugs like heroin.
We've got star athletes. We've got some guys and girls who had great promise, great families.
But because they had access to a pill bottle, addiction crept in.
The problem is just that bad.
McNabb and Morrison both say that the new law means everyone is paying the price for abusers. Healthcare professionals will now have several more hoops to jump through. That's to prescribe more than 3 days worth of these painkillers.
When you've got a national emergency, all of us have to pay the price.
An attempt to correct a problem that's taken thousands of lives. Morrison tells me this new law will impact people who need narcotics for a one-time thing, like a surgery. But people who have chronic pain, such as cancer patients, can be exempt. Josh?
Kylie, thank you. There's now an anonymous hotline you can call for suspected abuse. That number is 800-889-9789. You see that number right there on your screen right now.